What is the first thing the physician does after he delivers and cleans the baby up after birth? The first thing the physician does is he places the baby on the mother's chest to begin that mother-child bond. Having a baby is one of the most beautiful blessings a mother can experience in the world. However, there are some women who don't embrace the joys of being a mother. In fact, there are some women who have difficulty bonding with their baby. Postpartum depression is a medical condition that occurs in many women after having a baby. I like to quote from the March of Dimes. PPD is the most common complication for women after having a baby. It affects 1 in 7 women, 15%. There are 3 types of postpartum depression. You have baby blues, postpartum depression, and postpartum psychosis. Baby blues occurs within the first 2 to 3 days after a woman gives birth. Baby blues occurs when a woman is doing a lot of crying. She's cranky, tired, slightly moody, but mainly she's doing a lot of crying within the first 2 weeks. However, if your symptoms are lasting more than just 2 weeks, you may have postpartum depression. Women who go through postpartum depression are feeling more depressed than usual. They're more tired. They're more cranky. They have difficulty bonding with their babies. They feel like they are a failure. Shame, guilt, not eating, or eating too much. They have difficulty sleeping at night. If you have postpartum psychosis, it's more rare and it's more severe. I like to quote from also March of Dimes. Postpartum psychosis, a rare, severe form of depression, is not the same as PPD. About 1 to 2 in 1,000 women has postpartum psychosis after giving birth. Some experts say that postpartum psychosis is more strongly affected in women who have mental health disorders, such as bipolar disorder or schizoaffective disorder. Women who go through postpartum psychosis usually have these symptoms within the first 2 weeks after giving birth, or some experts also say it also occurs within the first 3 months after giving birth. Postpartum psychosis happens when women are feeling more confused. They are not in touch with reality. They're more paranoid. They feel like anyone and everyone is out to get them. They are seeing or hearing things that are not really there. They have thoughts of not only killing themselves, they have these really extreme mood swings, more anxious than usual. Most important to know is that women who go through postpartum psychosis have thoughts of also killing their babies. Women who go through postpartum psychosis need to seek immediate treatment. Men also have postpartum depression as well too. I know I didn't recognize it either. I didn't think they had postpartum depression, but men also go through postpartum depression as well too. I'd like to read you another quote. Condition often goes undiagnosed and untreated. 25% of new fathers will suffer from symptoms of postpartum depression. Only about 10% of cases are reported for postpartum depression. Now, men who go through postpartum depression, it's more common for men to get postpartum depression if the spouse has postpartum depression as well too. That's one of the biggest risk factors as to why men have postpartum depression. Some men also go through what they call daddy blues, and that also occurs too within the first few days after. And usually they go away within the first 2 weeks as well too. Once the husband is able to get time for himself, the daddy blues usually just go away. However, if the symptoms are lasting more than just 2 weeks, then men have postpartum depression. A lot of the times, the reason why these symptoms go undiagnosed in men, number one, men don't really recognize it. They are they don't want to talk about their feelings. They rather hide their feelings because they don't want to be a burden on their spouse. And nobody understands what is the cause of postpartum depression. There's many factors to explain postpartum depression. Some of the factors include genetics. It could be mental. Women could have a history of depression. Also, hormonal changes. When women are pregnant, their progesterone and estrogen levels increase during their pregnancy. However, after the woman delivers the baby, Our progesterone and estrogen levels go back to where they once were before getting pregnant. It's also a possibility as to why postpartum depression may occur in women. But there is hope. Postpartum depression, there is treatment. If you're having symptoms, here's some of the things you can do to help yourself. What you can do: go and seek help. You can join support groups. You can also talk to someone who's also going through the same things that you're going through and get their perspective on how you can go about healing. Uh, don't stop doing the things that you used to do that kept you happy. Also, bond with your baby. Most important, bond with your baby. I like to show a little bit of images that I picked out. Postpartum depression men. Oh, looks like my time is up. Here's another image. I hope you have enjoyed this speech. I enjoyed making it. I hope you learned a lot from it because I sure did researching this topic. Until next time, have a great day.